Hello everyone, Jennifer Blevins-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today I want to talk about HMO plans and what to look out for. HMO plans specifically can be very tricky for a lot of practices, especially new practices or practices that have very green or inexperienced staff at the front desk, because that's where the revenue cycle starts. There are other types of insurance plans, not just HMOs, that could fall into this same kind of category or requirements that we're going to talk about. So keep that in mind. However, I'm just going to say HMOs to keep it simple to help you understand my concern of what's going on in here. So HMO plans are designed to help keep healthcare costs minimal or lower. So because of that, it's different from a PPO plan where patients have a lot more flexibility in choosing who they see for different reasons, different specialties, things like that. HMO plans, patients who have HMO plans generally have a little bit smaller premium because of that cost control of the insurance being a little bit more hands-on and telling them what they can and cannot have done when it comes to their care. You can think of it as the PPO plan is kind of like free reign. The patients can do whatever they want. The HMO plans have more of a parent figure watching over them on everything they do and giving them approval or disapproval of what they want, okay? Then there's EPO plans and there's a bunch of other different kinds of plans, but those are the two major ones you're gonna see. In Oregon, we have a big HMO network called Kaiser Permanente. They are in other states as well, like California, Washington, I think Alaska, some other parts of the country. They're not huge, but if you live in those areas, you're probably familiar with them. They're a whole HMO system, and they're geared at preventive medicine, keeping costs low, getting authorizations, doing things by step of medicine rather than jumping into a surgery. They try conservative treatments more likely first and things like that. Same thing with these HMO plans. They're going to require more hands-on approvals for medications, diagnostic imaging, and even seeing providers depending on the specialty. What a lot of people don't realize is that a lot of HMO plans require patients to choose a primary care provider from their network that they keep on file for that patient. What that means is if you have a primary care on file with your insurance, you have to see that primary care doctor for your primary care concerns, or it can process as either out of network or it can be denied by the other primary care doctor who's seeing you that is not assigned in the insurance system. So for example, I have Dr. Smith as my primary care in the insurance system, but I don't realize that, or I don't realize the implications of that, and I don't care. I don't think I should care or it should matter. So I go see a different primary care. Well, that primary care didn't pay attention to see that I have an assigned HMO primary care doctor, and they see me without a referral. If they don't have a referral from my actual PCP that's on file, Dr. Smith at the insurance company is going to most likely deny that visit, especially if I don't have out-of-network benefits, because I'm not approved to see this primary care doctor. I need to see Dr. Smith. If you're inexperienced with running a practice, you are not familiar with the different plans in your area, you have people at the front desk that don't pay attention to this or don't know they need to pay attention to this, it can be a huge financial loss for you because you can't turn around and bill the patient for this. The insurances say this is the doctor's office responsibility. You should know you shouldn't see these patients without a referral because they're not an assigned patient to you, and you get to eat that. Well, that is a tough pill to swallow when you're not aware of it, you're not paying attention to it, And unfortunately, a lot of people don't even realize that's a thing until they've seen the same patient multiple times, because maybe there's a chronic issue going on or an acute issue they have to be seen multiple times for, or you've seen a lot of patients with that same plan not realizing. And it's not until you get those denials a few weeks later that you realize you've lost all this revenue. Sometimes insurances will allow the patient to call and ask to switch to the doctor in which they saw, and then they will reprocess the claims and it's not an issue. However, they're getting more strict on this and they're not always allowing that. They might say, okay, we've updated it in our system now to Dr. Jones for you, but those that you saw Dr. Jones that we had Dr. Smith listed, we're not going to pay for those, but we'll pay for the future ones moving forward. Ugh, that's really, really sucky. Unfortunately, again, it's falling on the responsibility of the practice. Sometimes you might not be contracted to see patients in that HMO. So even if the patient calls and says, I need to change to Dr. Jones, they might say, I'm sorry, I can't change you to Dr. Jones because they're not accepted on our network. We don't allow them, they're not participating to have patients assigned to them. And then you're really, really stuck. Unfortunately, patients get upset when you have to communicate this to them because, again, they sign up for these insurances not realizing that is a factor they need to consider when they're choosing their plans, if they get to choose. Sometimes they're just assigned a plan option through their employer, and that's what they have to take, and they don't realize it, which makes them even more frustrated, unfortunately. It's just an unfortunate situation, but it's one of those things that they learn from experience, unfortunately, just like doctor's offices sometimes. But it's really important that your staff, when you're scheduling patients, they have a new insurance or it's a new patient. They're not just asking for the insurance name like Blue Cross or Aetna, they're asking what it says on the card. Very key. They have to say open access plan, or you can specifically ask your staff to say, does it say PPO anywhere, or HMO or EPO? And patients will look at it and go, I see this. You mean that? Yes, yes, that's what I mean. Because you're starting that process from the beginning. If it says HMO and they register the patient and they're being seen in a week, that gives time for your staff to do their diligence. They can give an upfront kind of heads up to the patient, say, look, it's an HMO plan. We might have to get a referral. I will find out for you, make sure that we're in network, that they'll get the referral. And if there's any issues, I will call you and we'd have to reschedule or cancel you. But we can cross that bridge after I do more investigation. I think that's completely appropriate. But your front desk needs to know what to ask. They need to know what to look for, and then the steps to take after that if it is an HMO plan. With technology, we're very lucky, right? We have a lot of instruments and resources to be able to log on to payer portals to check about HMOs and assign PCPs. Sometimes even doing any kind of eligibility verification through the clearinghouse will give you that information. Use the tools that are provided to you for this. However, it's a very important thing to make sure that your staff understands and knows about this, that they know the expectations of their role in this, that they're communicating to patients appropriately, and that when the patient actually gets seen, that all those ducks are in a row so you can capture that revenue and there are no issues or loss of financial money. The other important thing, even though they're asking over the phone, what's on your card, is making sure when the patient checks in, they are looking at the card itself, analyzing it, not just grabbing it and scanning it, but they're actually paying attention to the information on it, what it says, the name of the plan, the type of plan. It gives you so much information by just looking at the card if you know what you're looking for. These are just things that you need to educate your staff about, give them a heads up. There are more HMO plans in some areas of the country than others, or maybe in a city of a state than other city in the same state, but you need to know what's in your area. And you need to pay attention to your denials. You need to pay attention to rejections, because that's also going to give you a heads up a lot of times before you even get as far as accumulating all these denials and loss of revenue. If you have any questions or comments about this, please leave that in the comments below. Again, it's not just HMOs that could be requiring this. It's just the most common. So make sure you have a heads up about this and you know what different types of insurances patients have in your practice, what's the volume, what's the requirements. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with your colleagues whom you feel would benefit from the information. I appreciate the support, and we'll see you next time. Bye-bye.